I know that there are a lot of people in this room right now that know all of this and have known all of this for a while and are wondering why things aren't still changing. And I just want to, now we're going to move gears because we've talked about functional medicine, we've talked about, the microbiome, and I know that there are a lot of people that care about this and know about this, but now we want to talk about the future and talk about how we're going to get to a new type of medical system. Because I said it was coming quickly, and, I know, as I said, we've known this for a while. So the first thing I would say, another thing that's happening right now that's so amazing and is a perfect example of the sea change is the new functional medicine center at the Cleveland Clinic. This has been announced. Mark Hyman announced it when we were on Huffington Post Live a couple weeks ago. But when the most prestigious and conservative and well-respected medical institution in the country announces essentially that functional medicine is going to be the future of chronic disease management for them, we know that we're on a change. So I think that's something very exciting to look forward to here. So Dr. Lippman does use coaches very effectively in his practice, and one of the things I just want to say before we get to Robin is that it's very important that doctors, at least a percentage of them, start to act like entrepreneurs. And everyone needs a coach. Patient needs a coach to take them through the process, and doctors need a coach too. And the reason I bring this up is a few years ago, I had an opportunity to speak. And who's visited Massage Envy? Does anyone know Massage Envy? Right, so Massage Envy is an organization that exists to basically get new patients for massage therapists. If you're a massage therapist and you can get your own patients, you don't work at Massage Envy because they only pay you a few dollars more than being a manager at McDonald's. The reason why you work at Massage Envy is because you don't know how to get new patients, and so you need someone to give them to you, and so you're quite happy to work for $20 an hour. Now, the infrastructure will come in to support the type of medicine that we're talking about here, because ultimately, this is good medicine, and ultimately, this is going to reduce costs for companies and payers and all organizations. But why is it important that doctors start to act like entrepreneurs? And it's because if you're an entrepreneur and you're building it yourself, you get to control what happens. No one else gets to tell you what to do. And so that's why we are really excited as the other sponsor for the season for us. Gabe and I have been running the Functional Forum for a year. We've had so many doctors that have come up to us and say, look, can you help us build this practice? Can you help us do that? And much as we would love to do that, we really don't have the time nor the sort of desire to do that, but there are people that are doing it and doing it really well. So Freedom Practice Coaching is going to be a partner with us this year in the Functional Forum every month, and we're going to bring content to doctors to talk about what are the best practices for building practices. And I really want to talk about this, and it's in the summit, because there are models emerging whereby which this type of medicine, functional medicine, can be delivered at scale to not just people in New York and LA, but everyone, to Kansas, to Nebraska, and to the people that really need it. And so in the summit on Saturday, we'll have Dr. Shilpa Saxena, who's developed an awesome group visit model. It gets the accountability and the support of a peer group. Imagine that, the power of that in medicine. She'll be talking about that on Saturday. We also have Mark Hyman, who's doing his announcement of the Cleveland Clinic, and then Dr. Jeff Glad, who's spoken on the Functional Forum before. He's developed a cash-only functional medicine practice in a poor zip code in rural Indiana, and he's done it through the use of technology, and so there's a lot of potential for that, and that's leads us perfectly into our last segment. Now, I've known Dr. Robin Berzin for a couple of years, and I'm really excited to bring her to this stage now because I sort of feel a bit myself like a health hipster, like I knew about this stuff before it was cool because I did homeopathy when I was a kid. And I'm very glad to know Robin Berzin now because I think she's going to be a superstar of medicine in this next few years. Already on her resume, she's younger than me, and already on her resume, she was a producer on the Dr. Oz show when the Dr. Oz show was on radio. When she was in residency, as though you didn't have enough stuff to do in residency, she created an app called Curator that is doing HIPAA-compliant text messaging in hospitals. She is also an advisor to many brands. Just last week, she was speaking at the Clinton Global Initiative. Dr. Berzin is on this amazing corner, this amazing apex, if you will, which is the corner of functional medicine and digital technology. And so the second talk that we have this evening is by Dr. Robin Berzin, and it's called Empowering at Scale.
Thank you so much. And first off, I just want to thank ABC for hosting this. This is absolutely brilliant and amazing thing to be a part of. And I also want to thank the legends in the room like Frank Littman and Leo Gallen, Morton Teach, Jeff Morrison, who have paved the way for the evolution of medicine. You guys are the reason I'm standing here, so thank you for doing all of that hard work. Now I want everyone in the room to raise your hand if you have a smartphone. iPhone, Android, everybody? Okay. And now I want you to raise your hand if you saw a doctor in the past year. So this could be a dermatologist, primary care, emergency room, what have you. Great, everyone. Now I want you to think for a second, which was more efficient, convenient, delightful, or empowering? Your interaction with your doctor or your interaction with your smartphone? Because for me, I recently had an experience, I went to my OBGYN annual visit, and it was none of those things. She was an hour late, and when I did finally see her, the visit was about 15 minutes, and I got so flustered that I forgot to ask the question that I actually had to ask her. And despite the fact that I've been seeing her for 5 years since medical school, she definitely didn't recognize me. And I left thinking something that I think about a lot because I'm interested in tech, that, wow, medicine really needs to take a cue from design, from technology, and be a little bit more like my smartphone, be a little bit more like this iPad I'm holding. So in the design process, in technology, it goes something like this. You identify a problem, you dream up a wild and crazy solution, you build a prototype, you iterate on that prototype, you throw caution to the wind and ignore all of the obstacles, and then you see what happens from there. And generally, the best solutions that come are user-generated, meaning they're built by the people who truly understand the problems. And from there, you see what your awesome new invention can do. So we've seen in the past 7 years, the iPhone actually came out only 7 years ago, which is extraordinary. We've seen our communication revolutionized. The banal correspondence of everyday life is sexy and fun and shareable and efficient, and that's happened in 7 years. And this is why I think functional medicine is so absolutely amazing. Because functional medicine is a paradigm shift because it's a redesign, fundamentally, of primary care. Now, like many of the doctors have spoken here tonight have shared with you, we focus on getting to the root cause of disease instead of just treating the symptom. We always spend time with our patients. There are no 15-minute visits. We use natural therapies that are sustainable wherever possible, like diet and lifestyle and botanical medicines and supplements that have a much lower risk profile than synthetic drugs. And our communication is always a two-way street because we depend on our patients taking responsibility for their health. So in this way, functional medicine is already more convenient and efficient and delightful and empowering to our patients because we have to be. That's what we do. We empower people to live healthier lives. We empower them to live their way to wellness. And in order for us to have functional medicine become the standard of care, which is one of my personal goals and something that I think we can all agree that we want to see happen, I think one of the things that functional medicine has to do is it has to become more like our iPhones. It has to become more prevalent, and it has to become just as wonderfully designed. And I've been thinking about scale a bunch lately because two patients actually have stood out and made me think about scale, and they've stood out because they're atypical. So I have one patient, his name is Alfred, he's in his 40s, he's an elevator repairman, and he came to us with high blood pressure, high cholesterol, pre-diabetes, a big belly, kind of the sad standard American stuff. And Joe Cross somehow had gotten to him through the airwaves, and he had gotten into juicing, but he was still eating a lot of processed and refined food. His regular doctor wanted to put him on a ton of different medicines and effectively wait until he got diabetes and then start him on insulin. And instead, we changed his diet. We took out dairy, we took out sugar, processed foods. We gave him some supplements. We helped him figure out an exercise regimen. And we turned his entire picture around in a matter of 2 months. But Alfred, Alfred is rare, and Alfred found us, but I found myself wondering, how do we find him? And then I have another patient I've been thinking about a lot lately. Her name is Mary, and she's around 73 years old. She's originally from Peru. And she came to us with metastatic lung cancer that had spread extensively to her liver and her bones. And she came to us for natural approaches to her care. Just diet, advice, supplements, things are going to help her feel better in what is, I think, probably the last year of her life. And I realized very quickly in working with her that I could give her all the supplements in the world, but what she needed was home health care because she was getting so weak she couldn't do her own grocery shopping. And what she needed was a social worker. And I tried to plug her into some of these services, but I realized that as a functional medicine doctor, I was kind of not plugged into that world. I wasn't really able to help her get those things. And these patients, again, they both stood out to me because they're atypical. A lot of the patients that we see in functional medicine, they're wealthy or they have a long history with the medical system. And so they're already advocates for their own care because they found us in the first place. But I think about what about the less wealthy, the less educated, the less pushy sometimes, or the less empowered? How do we reach them? How do we find these other people? And I think that's actually the real question and some of the real question of why we're here tonight and why we're talking about the evolution of medicine. Because if you zoom out a little bit, Mary and Alfred are most people. And the statistics are staggering, and I think a lot of us are pretty familiar with them, but it's really true that most of us are not living our way to wellness, we're living our way to disease. Over half the people in this room, half the people in America will have pre-diabetes or diabetes by the year 2020, and that will cost our country $500 billion a year. Over 2/3 of Americans are overweight or obese, and the incidence of preventable cancer is skyrocketing. Cancer that's due to things like diet and lifestyle, obesity, smoking. So this is now the world that we live in, and in the face of all of that, we have a projected 90,000 doctor shortage by the year 2020, a full half of which is primary care doctors. So we are missing 45,000 primary care doctors. Now, I see this actually as a huge opportunity for functional medicine because functional medicine is designed exactly to solve these problems. Functional medicine is designed to help people live their way to wellness. And so I don't think what we need is more primary care doctors, as James has said. I think what we need to do is have functional medicine fill that gap and change everything. Okay, tall order. How do we do that? How does functional medicine build to scale and fill in this gap of 45,000 missing doctors? Well, as James mentioned, we have a huge, amazing thing happening next month. The Functional Medicine Center at the Cleveland Clinic will open its doors on October 1st, and that's a major line in the sand to have a partnership with an academic institution of that caliber. It's awesome. But I think the real impact has to happen on the demand side, and I don't think that we can go one hospital at a time. I actually think we need to follow the lead of a company that a lot of people love to hate. It's called Walmart. And Walmart has opened a series of primary care clinics in its stores in the Southeast, and I think we need to follow suit and go beyond the hospital system into the community. We need to go where the people need us, and we need to reach people where they are as functional medicine providers. Okay, so I'm supposed to talk about tech, and I will, I promise. I'm not going to talk about the microbiome, I'm going to talk about tech. And it's this reaching people where they are where digital technology really comes in. Because the tools that we need to reach people where they are, as we've shown by everyone raising their hands earlier, in all of your pockets right now. 65% of Americans, and this number is climbing every day, have a smartphone. The average number of devices people have is 4. And as James mentioned, the iWatch comes out tomorrow. And you guys are probably thinking, gosh, I just want to throw my iPhone out the window. But if I threw your smartphone out the window right now, you would kill me. And you would run after it and go get it. And the answer is not to throw these things out the window. It's to work as a functional medicine community to harness the power of what these digital tools have that are in everyone's hands already and reach more people like my patients Alfred and Mary. So there's some things that functional medicine already does really well, and these are things that digital technology can help us do even better or help us do at least at scale. So the first one, as Dr. Lippman mentioned, is education. We are teachers, and what we do as functional medicine doctors a lot of the time is we teach people how to eat, sleep, move, shop, to live a healthier life. So someone like Alfred, I was thinking about him, you know, a lot of the changes that I helped him make, he could have made on his own if he had that information at his fingertips. And the exciting thing is that in a lot of ways he already does. Sites like Mind Body Green are aggregating wellness information, the best of the best from around the world. Apps from the Environmental Working Group that Heather has been a part of, like Skin Deep and the Food Database, are letting people know at the point of sale when they buy their products or their food what toxins are in them. This is huge. A lot of what we do all day is spend, as functional medicine doctors, is spend time educating people on how to live healthier. And these tools are there to help our patients and help us. Now, another thing that we do as functional medicine doctors is we spend time making people just aware. We build consciousness. And it's a really, really hard thing to do. And wearables actually get a bad rap, the Fitbits and the Fuel Bands and the Ups, and a lot of people are saying, oh, you know, I use these things for 2 weeks and I throw them out. What's the point of tracking your steps? But I think we have to remember that this is like the 80s cell phone in the era of wearables that we're in right now. These things are going to get smaller and they're going to be everywhere. And the era of the Internet of Things is only just beginning, meaning that basic consumer goods are equipped with data collection devices that transmit information wirelessly. This is only beginning. And so if you can get your patients or anyone just wearing something that shows them day to day that different, you know, what their stress biomarkers are, whether or not how many calories they're eating, this is just another way for us to help cultivate awareness for our patients when we're not there. And that's a huge part of what functional medicine does. And then there's something that, you know, we take for granted, and that's mobile. And I think about Mary and how it took her a lot to get to her office, you know, every week at one point, and how there really are already tools out there that I could reach her without her having to come to me. And this is where telemedicine comes in. And with telemedicine, functional medicine can scale. We can reach everyone. There are tools like Skype and Google Hangout and Doctor On Demand and Zoom that allow us to reach more people at scale now. So those are the things that functional medicine does well, that digital technology can help us scale. But there are a couple of things that I think that we don't do so well that are some big challenges that we need to face and step up to if we're going to make functional medicine the standard of care, if we're going to help all of these millions and thousands of people live healthier lives. So the first one is tracking outcomes. And this is a big talk right now across medicine and conventional medicine as well, because a lot of people are about to not get paid if they don't actually prove that what they're doing is working. And sometimes in functional medicine, I think we're sort of a little bit outside of that. You know, we don't necessarily operate within that system, but the reason that we as functional medicine physicians need to track outcomes is not about that. It's because we have to prove that this works. We know it works. All of us sitting here, we know it works. We do this every day. We see incredible outcomes in our patients. But until we have the data and we use big data and big data analytics to prove it and show the world, they don't have to believe us, and we need to make sure that they do. And then the second big challenge that I think we really have to face to scale functional medicine to everyone is something of the elephant in the room in functional medicine, but I'm just going to talk about it, and it's affordability. So the reality is that I can't actually afford to see myself, which doesn't make a lot of sense. And most of my friends can't afford to see me. And we cannot reach the many, many Americans or people across the world who need to see us if we cost hundreds of thousands of dollars a day. We just can't. So what I would say that we need to do is harness the digital technologies that expand our reach and offer functional medicine services to the public at affordable prices. Say it again. We need to harness the digital technologies that are in our pockets that expand our reach and offer functional medicine services to the public at affordable prices. Okay, so how do we do that? Well, this is the boring stuff, but the boring stuff is always the most important part of medicine. So it comes down to things like back-end administrative tools that make our practices less expensive to run, and cloud-based EMRs that let people work from home and share records with their patients. It's using services that exist like HealthWave to manage supplements. You know, none of us became doctors and health coaches to be supplement dispensaries, but that's part of what we do. Those are the tools that we need to help people heal, so we need to get more efficient at that. And I think that if we take tracking outcomes and affordability seriously, even though they may seem like massive mountains to climb, We can use technology to climb those mountains, and we will get there, and we will see functional medicine scale to become what everybody expects to receive in their medical care. So everyone in this room has the power to help see functional medicine reach scale. If you are in here, you are an innovator, and so I know that you're already doing it. But here are a couple of my tips for how to help this process go along a little bit faster. So first up, I think, is shifting your personal expectation for how medicine works. Probably everyone in here used an app today. Maybe you text messaged. Maybe you're Instagramming right now. I'm at Robin Berzin, MD. But regardless of what you're doing, I'm not advocating that you become an addict to your phone, but I am advocating that you expect these devices that make every day efficient and convenient and empowering and delightful, you expect those services to serve you just as well in your work in health and wellness and medicine. And the second step that you can take is to talk to your patients or talk to your friends or talk to people you know about tech and what's available. There are amazing apps out there. There are amazing tools for people. A lot of what we spend time doing in functional medicine is asking people to change their lives. And that's really hard. And as Dr. Lippin mentioned, we need to go beyond our visits with them and help them do that. And so there's websites like Mama Glow and apps like Glow that help women have healthy pregnancies. There's apps like Skin Deep, as we've talked about, that help you make better decisions about the kind of products you put on your skin. There are apps like Map My Fitness and Meal Logger that are, food diaries that you can have on the go. All of these things exist, and if we tell our patients about them and use them ourselves, we're going to have a much easier time seeing functional medicine grow. And the last thing I would encourage you to do is to share what you know. So downtown right now, there are a bunch of kids cooped up in a large loft in one of the health tech startup incubators, occasionally doing work and also playing ping pong. But they are trying to build digital health technologies that are going to really help change the world. And what they need is our input. They need us to tell them what to build. The best solutions come from the people that know the problems. We know the problems if we're working in this community. What we have to do is collaborate with the innovators on the tech side, because we are the innovators on the clinical side, and together create the future of medicine. Okay, so my vision is fundamentally that functional medicine will be like the iPhone. And it will be like the iPhone in that the iPhone is this practical, beautiful luxury. But it's a practical, beautiful luxury that we all have, and we all have it because it's attainable. The iPhone has revolutionized how we communicate in a mere 7 years, and I fundamentally believe that we can change primary care, change conventional medicine, fill in the gaps of those missing doctors with something functional by using this amazing paradigm that is functional medicine. But to do that, we have to use these tools that are in our pockets and at our fingertips. We have to use this digital toolbox here, now, and today that's going to help us empower everyone to live their way to wellness and to live their way to happier, healthier lives. Thank you.